Dr. Holly is a registered dietitian with a PhD in health promotion from Western University. She completed both her undergraduate and master's degree in the field of food and nutritional sciences. Holly has also taught on introductory nutritional sciences and adolescent nutrition at Western University. Her research explores predictors in adolescent and post-secondary student diet quality, behavior, change interventions, integration of health technology in nutrition, and the influence of equity factors in nutrition outcomes and intervention effectiveness. Workshop key points. 1. General healthy eating principles for adults. 2. Eating principles for respiratory health. 3. Nutrition therapy and recommendations for individuals with lung diseases. Examples: chronic obstructive pulmonary disease.
Okay, we can now hand over to Holly to start.
All right, can you all see my slides? Good.
Yes, Holly, we can see your slide.
Perfect. All right, so as was just mentioned, I will be looking or talking about healthy eating for adults and respiratory health. So I will give a bit of a disclosure statement, is that my background is, as you heard from my bio, is behavior change interventions, adolescents, post-secondary student diet quality and health. So I am a more population level health promotion research dietitian. I'm not a clinical dietitian, so I don't work individually or have any specialty within lung disease. However, I was asked to talk about lung disease and respiratory health for the topic of Annual Health Week. So for that reason, I'm going to be focusing my lecture to be more educational based, more just looking at general healthy eating principles and just very high level information regarding respiratory health and nutrition and what's currently known inside of nutrition research that can be applied to this topic. So for that reason, my format will be looking at, as mentioned, general healthy eating for adults, then looking a bit more specifically at respiratory health and healthy eating, and then just very briefly on some nutrition therapy and recommendations that are currently out there for lung diseases, particularly COPD, as that's the most commonly one that's looked at within dietitians in clinical practice. But again, this is all very general information. And again, my specialty is not, instead of lung disease, our clinical dietetics. So recommendations may vary across different health professionals. And this is just a general knowledge of what's currently known in the literature. So starting with general healthy eating for adults, we're going to start with the very basic Canada's Food Guide. So some of you may or may not be aware, Canada's Food Guide was updated in 2019. So although 2019 is now 6 years ago, when I started my undergraduate degree, it switched over in my first year. So for me, it was a change having to learn both the previous food guide, which had servings of different food groups, and it had separated meat and dairy and fruits and vegetables and grains as different food groups. And you had to get a certain number from each to have what was considered a healthy diet. In 2019, we switched this to being this healthy plate method. So a few reasons why this happened. Mainly first, it's easier. We found within dietetic practice and within research and trying to improve individuals' diet and their health, having to memorize food groups is a lot more difficult than simply having an individual try to remember what this healthy plate looks like. So very generally, what it looks like is half your plate should be fruits and vegetables. A quarter of your plate should be high protein foods. And this includes your meat products, your dairy products like yogurt, cheese, beans and legumes, vegetarian sources of protein like beans and legumes. And then that other quarter of your plate is going to make up your carbohydrates, which are your grains. And the goal here is to choose whole grain products. This could be, whole wheat rice, barley, oats, whole grain pasta, whole grain bread products. But that's what we look at when we're talking about that plate method. So half fruits and vegetables, a quarter high protein foods, and then a quarter of those whole grain foods. So those serving sizes are those food groups are still within there. So fruit, vegetable, obviously that's listed. But within protein foods, you still see things like yogurts, your dairy products. You still see things like your milk and your eggs, your poultry. Things like that are all still incorporated into the food guide. It's just now clustered into its own category of protein foods. Also to recognize that individuals who are following a vegetarian diet are still eating protein foods. It just might look different than someone who follows a more conventional diet, but they're all considered protein. And then another difference that has now as well is that water is now considered, the drink of choice. And although, dairy products are listed as a healthier alternative, water really gets the highlight with Canada's food guide. And it's really the main focus of it. So beyond just this plate method, which is what's typically used and talked about in practice, we also have different principles that are discussed within the food guide. And if you go to the link that's listed there, you'll see all these principles listed as well. The first main principle is to eat a variety of foods. And I'm not sure if anyone's heard of that phrase, eat the rainbow, eat foods a different color. And there is some validity to this, and it comes back to this concept of variety. So, for example, dark leafy green vegetables are typically high in B vitamins and folate, which is also a B vitamin. Versus in comparison, orange vegetables are high in beta carotene, which is a form of vitamin A. So when we have a variety of different types of vegetables, for example, opposed to just eating carrots every single day, you're really only going to be consuming, maybe a little bit of vitamin C, some beta carotene, but you're going to be missing out on some of these other key minerals and vitamins unless you're incorporating other types of vegetables and fruits as well. So that's why we want to have a variety of foods. Going beyond fruits and vegetables, having a variety of different types of, processing methods. So, frozen compared to fresh. Frozen gets a bit of flack because, there's an assumption that it's less nutritious. When in comparison, frozen foods actually retain a majority of their nutritional value throughout the freezing process. It actually destroys very minimal amount of nutrients. So it's quite considerably similar compared to fresh produce. Within the canning process, there's going to be some loss of nutrients throughout that. However, they're still beneficial and they're still, a good idea to include. So with that being said, again, having a variety of different types of fruits and vegetables and different processing methods. When we're talking about like protein foods, for example, chicken, although it is, it's low in saturated fats, which is great, it's high status, is things like shortness of breath, fatigue, loss of appetite. And this can result in possible complications such as weight loss. And then there's also a complication of high blood pressure that can occur across these diseases. So when we think about these things like fatigue and loss of appetite, we think, how is this going to impact that nutritional status? So the main thing that we want to be ensuring is adequate intake. So going back to that key, healthy eating principle of adequacy, not only is it caloric adequacy and making sure individuals are eating enough food, it's also are they eating enough of the different macronutrients as well as micronutrient intake. So there may be some requirement of support as far as food procurement and preparation. This depends on the stage of the disease and the severity of symptoms. So if an individual doesn't have the energy, for example, to be making their own foods, they were likely going to require some support from family or possibly healthcare workers or caregivers that can provide them with food or even, help them with the cooking process or getting those foods to them. In some cases, oral supplementation such as Boost or Ensure, which are, high in calories and protein and things like that, may be needed just to improve that dietary intake in individuals who are malnourished or really are not getting enough nutrients inside their body. Vitamin D supplementation may be needed depending on their blood levels. So again, this goes back to within a nutritional assessment within a hospital, if an individual has COPD, for example, they're going to get their blood work checked, and then the dietitian would then look and see where the vitamin D status is at and see if there's a need for supplementing. And like I said before, Canadians and older adults are going to have a higher risk of deficiency compared to other populations. Currently, there's not enough evidence to support the supplementation of other micronutrients beyond vitamin D, but there's definitely an encouragement of intake from foods for things like omega-3, as well as ensuring adequate intake of fruits and vegetables to get that antioxidant and that fiber intake to make sure we're meeting those needs for those key nutrients we talked about, like vitamin C. As far as how to eat, small frequent meals are typically suggested, particularly for individuals who are experiencing shortness of breath or they're experiencing fatigue and find it difficult to have a large meal. Eating with others is also a great way to encourage better intake. So again, I talked about this earlier about how to eat with that social aspects. And this is particularly true for individuals who are experiencing lung disease and have that, some of those severe symptoms. This might be a beneficial way to get them to consume more. And there is a bit of concern about that sodium intake, and this is due to the risk of swelling and edema and possible blood pressure concerns that can occur within lung diseases if those symptoms are severe. So there might be a consideration about our sodium intake. And in general, and this goes across all diseases, this is not specific to lung disease, but limiting or minimizing intake of alcohol is definitely going to be something that is suggested.